Manual therapy is a hands-on approach, and it's so important that you are well trained and you feel the body, but you don't just trust your hands. It's important to work off of medical investigations. It's important to be trained in the field. Just working off of your own biases or your own intuition alone is unsafe. You don't know what's going on under the skin, under the superficial tissue, and you really need to do the proper medical steps to make sure that you're never going to hurt anyone. And in the end of the day, that's not why we all are doing this. We're trying to help, right? So working off of your own ego is, it's not advised, it's not correct. You should be following the proper protocols, following the proper steps to make sure that you never hurt anyone. Let's talk a little bit about what I believe are the most popular practices of physical therapy. And I'll start with the first one that I see the most often, which is orthopedic physical therapy. It's people who have traumas and injuries that you want to rehabilitate. A very popular one is the shoulder joint, I would say. I think about 60% of people have some form of shoulder impingement, if not more. Especially in Moldova, I would say those numbers are quite a bit higher. And I can explain why. Because the shoulder is a very shallow articulation. It's a very shallow joint, and it's only balanced by muscles. So if you have muscular imbalance, you will get a misalignment of the shoulder joint, which causes impingement syndromes. So I'd say the most popular issue that patients come with are herniations. Whether they're diagnosed or undiagnosed, we obviously, once you come and we suspect it, we send you for a proper investigation to actually diagnose it. There's no working off of our theories. We work with facts, we work with investigations. That way we can see the best way to treat it as well, whether or not it's surgical intervention or we can treat conservatively. Most of our patients, though, we can treat conservatively. Herniations themselves are generally asymptomatic unless there's nerve compression. So, I mean, that's great news for all of you. The approach that we take at ADLER is unique in Moldova, honestly. We work together as one team for you, the patient. We discuss together. There's no single specialist who knows it all and does it all by themselves. It's not the right approach to medicine. Medicine is multidisciplinary. There are a few problems going on at the same time, and we need to work together to properly resolve the issue. That's how you get the good results. That's how you get complete resolving of issues, of pathologies. And that's what we do at ADLER. There's no one person with a big head and does it all themselves. It's not the right approach, in my opinion. The minute you enter ADLER, you'll feel that. It's the minute you walk in. The reception greets you. There's a nice ambiance in the clinic. We're all treating you with respect because we all feel like we're helping. It doesn't matter if it's the infirmary, the cleaning lady who's keeping the floors clean, or if it's the doctor who's the one actually treating you and prescribing you medication. We're all working together for your benefit to help you feel better. The minute you walk in the door, that's how it is. Since the beginning, the approach of ADLER has always been, we're going to bring the best devices and pair it with very good specialists. So we have a number of unique devices in the clinic. We have Spineliner, we have Pelvis Center, we have top-of-the-line physio equipment to help treat you. We're going to have ozone therapy soon. We're trying to find the best devices in the field to bring them so we can get the best results. Because the specialists in Moldova, they're good. But a lot of them lack proper equipment. A lot of centers state there's not proper funding for the best equipment, the most modern equipment to get the best results. And how do we commit to that? We are investing in that. So we get better results than a lot of other clinics because of that. We have the most modern technology. In cosmetology, we have Candela, GentleMax Pro, we have Alma Harmony XL Pro. We have all these devices that are expensive, but they do better jobs. They work better, they're more efficient, they're less pain. These are all the things that we take into account when we're researching what devices to bring, what technology to invest in. Maybe that's my personal approach as a physical therapist, but at ADLER, as a team, we work to provide you a life without pain. That's our slogan, A viață fără dureri. It's important to be able to go through your day without suffering. If you're suffering, if you have pain stopping you from doing the things that you love, come to ADLER. We'll help.